Hello. So in two short videos, we'll go through how you can do a basic cardiac MRI scan starting from the very beginning. And the very beginning is usually when you receive a referral to do a cardiac MRI scan. And the referral, you need a number of information. You need to know the clinical history of the patient. You need to know results of any previous imaging. And most importantly, you need to have a clinical question to answer. You need to know why the doctor referred this patient for cardiac MRI scan. What are they expecting from this cardiac MRI scan? Because the question will help you to plan the protocol, the scanning protocol for the patient. It gives you a rough estimate how long this scan will take, because this is very important when you plan a clinical service and you want to know how many patients you can fit in your working hours. Also, you will need some basic information about the patient, like is your patient very frail? Is your patient able to for breath holding? Is the patient able to follow instruction? All this helps you to plan the right protocol to answer the question required. Third step will be the safety check. And I can't stress enough how important is the safety check, because we know first do no harm. You need a number of information to go through your safety check. Some centers will send a safety check form to the patient before the scan, so they have all the information before the appointment. Some centers will do this on the day of the scan before the appointment. Usually, to have this information ahead before the day of the scan is obviously better, because it helps you to plan things in a better way. You need to know any medical condition your patient has, medications they take. If your patient has very frequent seizures, for example, you need to know about this. You don't want to be surprised by your patient having seizure inside a magnet. You need to know about any implants or any devices. You need to check if it's MRI compatible or incompatible, and you can check mrisafety.com for this. You need to know any pacemakers or ICD. This probably will be a topic of a different day to go in more details about this. With the implants and devices, you need to know about any ferromagnet material or any metal that can be in your patient, any eye sharpener. This can be very serious. If your patient is diabetic, you need to know about insulin pumps, diabetes sensor, with your patient to plan the day that you will do the scan so you don't affect this. You need to know if your patient is pregnant or breastfeeding. This obviously, usually we don't do scan usually in the very early pregnancy. We don't give gadolinium contrast during pregnancy. Breastfeeding, we can give gadolinium contrast, but usually we discuss with the mother and see if she wants to stop breastfeeding, like for a day or two, or maybe she decide not to have gadolinium altogether. You need to know if your patient has any chronic kidney disease, obviously because of the risk of nephrogenic systemic fibrosis in patient on dialysis and advanced kidney disease. Obviously, you need to know what commercial type of gadolinium you use in your center. You need to know about any allergy, especially any allergy to a gadolinium-based contrast. And you need to know if your patient is claustrophobic. Claustrophobia is not a contraindication to perform a cardiac MRI scan, but it can cost you a lot of time and effort. So maybe from the beginning, if you have a big magnet, you decide to put this patient in the big magnet. You just decide, do you think you need sedation, oral sedation, or intravenous? You decide also how you put the patient in the magnet. Will you go head first, feet first? Will you go in a supine or prone position? On the day of the scan itself, it is usually very useful to invest a few minutes to explain the scan to the patient. Explain to them that the scanner is very noisy, they need ear protection, but most importantly, to agree with them on the breath holding instruction. Make sure that you use instructions that are easily understood by the patient. Sometimes you give instructions that seems to be straightforward, but your patient doesn't understand it. For example, for a long time, we will tell patient breathe in, breathe out and hold, and then we realize that most patients don't really understand what we mean. So we start saying breathe in, breathe out, and stop instead of hold. And stop, everyone understand what we mean by stop. So just this is a very small example, and it we wasted a lot of time to arrange this. So if you do this before the scan, it saves you a lot of time. We ask patient to change into a hospital gown. There is a risk that the fabric might have their fabric or clothing might have some metal. There is a risk of heating and burns, and so hospital gown usually is a safe choice to go with. Then you need to make sure that it is safe to approach. Safe to approach meaning that if the patient needs a wheelchair or trolley, you need to make sure that you are using MRI compatible. Make sure there is no monitors, there is no wires attached to the patient. After this, now you are in the scanner room. Patient will lie on table. You will clean the chest using special gel, and you will attach your MRI compatible ECG electrodes. Check your ECG signal and make sure you are happy with this. Then you attach your receiver coil. It is important to make sure that you don't have any loops, so the wires coming from the coil are not looping like this. It needs to be straight and avoid any skin contact with the patient because there is a risk of heating and risk of burns. After this, with the scan, you check to decide on your ISO center. ISO center is basically, if this is a magnet, is the center of the magnet, and it is a point when we have the most signal homogeneity, and you want your region of interest, in this case the heart, to be in the center. So you move the table inside, your patient is inside the magnet, and you are now ready to start your scanning, which will be the topic of the next video.